Hi, my name is Paromita Hore, and I'm an environmental health scientist at the New York City Department of Health and Mental Hygiene. My colleagues and I published a paper about health remedies as a potential source of lead, mercury, and arsenic exposure in the American Journal of Public Health. I'm here to tell you about what we learned. The story begins with lead, and to start, I will give you a background on lead and how we started identifying lead-containing consumer products in New York City. Lead is a harmful metal. Lead exposure can result in a host of detrimental health effects across all ages, including developmental and behavioral problems in children, increased risk of miscarriage during pregnancy, and cardiovascular, kidney, neurological, and reproductive health problems among adults. Prevention is key to avoiding the health consequences of lead exposure and can be achieved by identifying and removing potential sources of lead. How does New York City Health Department identify lead-containing consumer products? Certain New York City populations are required by law to be routinely monitored for blood lead. For instance, per New York State law, providers must give a blood lead test to children ages 1 and 2 years and assess children up to age 6 for a lead risk factor, and if deemed at risk, the provider must give a blood lead test. Similarly, providers must evaluate pregnant individuals for lead exposure and administer a blood lead test if deemed at risk. Federal law requires routine blood lead monitoring of individuals who are occupationally exposed to elevated levels of lead because of their jobs. New York City Health Department receives the blood lead levels for all New York City residents, both children and adults, and conducts follow-up investigations to determine the lead source for these individuals. As part of the follow-up, department investigators conduct a risk assessment interview asking questions about a variety of lead risk factors. As informed by the interview process, investigators collect samples of consumer products that are suspected to contain lead and reportedly mouthed or ingested by the lead-poisoned individual. The New York City Health Department also routinely visits New York City stores incognito to determine availability of lead-containing hazardous consumer products. Samples of collected products are sent to an accredited lab for lead testing. Certain consumer products are also tested for other metals, such as arsenic and mercury. Investigators document product-related information for all consumer products that are sampled and tested. Information such as product name, what the product is used for, and where the product was purchased are systematically cataloged in an internal database. Product-related information is also publicly available via New York City Open Data. The QR code on this slide takes you to this data. Through this process, we have identified a variety of consumer products found to contain high levels of lead and associated with elevated blood lead levels in New York City children and adults. These consumer products include traditional health remedies, foods and spices, cosmetics and religious powders, jewelry and amulets, and ceramic and metalware from around the world. The objective of this paper was to describe the types of health remedies tested during New York City Health Department investigations over a 10-year period and the corresponding lead, mercury, and arsenic concentrations in these remedies. We also explore associations between potential lead exposures and blood lead levels among users of these health remedies. In this study, we included 584 samples of health remedies that were collected between 2010 and 2019 during poisoning investigations in New York City store surveys. These samples were tested for lead, mercury, or arsenic. The health remedies were grouped into 7 categories based on product labels or as reported by cases. These included medications from the ancient medical systems of Ayurveda and Unani, traditional Chinese medicine or TCM, and homeopathy. In the case of Ayurvedic medications, we incorporated a subcategory, rasa shastra, a type of Ayurvedic medication prepared with metal, mineral, or gem compounds. We categorize loose products such as powder, pellets, tablets, or capsules with unknown packaging or the term herbal indicated on the product packaging as traditional or herbal. We categorize dietary supplements available over the counter as supplements, and conventional medicines, including prescription medicine and other conventional drugs, were tagged as prescription. For each health remedy type, we compared lead, mercury, and arsenic concentrations and the proportion of products exceeding reference limits. Rasa Shastra Ayurvedic medications were significantly more likely than other types of remedies to contain lead, mercury, and arsenic at levels as high as 220,000 times permissible limits. Of the 51 Rasa Shastra medications analyzed for lead, 94% exceeded 2 parts per million, a permissible limit for lead in certain food additives used by the New York City Health Department as a guidance value. Similarly, 73% exceeded the 10 parts per million permissible limit referenced by the World Health Organization and the Indian Ministry of Health and Family Welfare's Ministry of Ayurveda, Yoga and Naturopathy, Unani, Siddha, and Homeopathy, or Ayush. 88% of Rasa Shastra medications exceeded the Ayush reference limit for mercury of 1 part per million, and 74% exceeded the Ayush reference limit for arsenic of 3 parts per million. Most of the Rasa Shastra Ayurvedic medications were collected during lead poisoning investigations involving pregnant and non-pregnant adults. Several were collected during lead poisoning investigations involving children and during New York City store surveys. These Rasa Shastra medications had a variety of indications, primarily related to reproductive issues such as improving fertility and having a healthy pregnancy, and several individuals indicated using these products to conceive a male child. Treatment of diabetes and treatment of skin problems were the next commonly reported indications. Almost all of the Rasa Shastra medications associated with lead poisoning cases were manufactured in India, and a majority were also purchased in India. Since concurrent use of multiple Rasa Shastra Ayurvedic medications is not uncommon, we calculated cumulative daily lead exposures from Rasa Shastra use for adult users of these medications and explored associations with blood lead levels for this group. Cumulative daily lead exposures from Rasa Shastra medications for adult users ranged from approximately 3 to over 177,000 micrograms per day. For reference, the U.S. Pharmacopoeia oral permissible daily exposure limit for lead is 5 micrograms per day. Blood lead levels for these users ranged from 2 to 96 microgram per deciliter. There was a significant association between blood lead levels and estimated cumulative daily lead exposures among adult users of Rasa Shastra Ayurvedic medications. We also compared mean blood lead levels and median cumulative daily lead exposures between adults using Rasa Shastra medications versus other types of non-Ayurvedic health remedies. Average blood lead levels among adult Rasa Shastra users were significantly higher than levels among those using other types of non-Ayurvedic health remedies. We also found that cumulative median daily exposures for lead, mercury, and arsenic were significantly higher among users of Rasa Shastra Ayurvedic medications than among users of other types of non-Ayurvedic health remedies. In conclusion, Rasa Shastra Ayurvedic medications can contain very high levels of lead, mercury, and arsenic. In this study, there was a significant association between blood lead levels and estimated cumulative daily lead exposures among adult users of Rasa Shastra Ayurvedic medications. We also found that average blood lead levels among adult users of Rasa Shastra Ayurvedic medications were significantly higher than blood lead levels among those using other types of non-Ayurvedic health remedies. Public health implications. The general ease of accessibility to Rasa Shastra Ayurvedic medications raises concerns. Findings underscore the importance of screening for lead, mercury, and arsenic exposures within at-risk populations. There is a need for systemic change that results in primary prevention, that is, removal of the source through policy development and regulatory enforcement in the countries of origin. We thank the staff of the Bureau of Environmental Disease and Injury Prevention, who provided tireless support with collection of case information, sample processing, data analysis, enforcement, and educational activities. We also thank external partners, both governmental and nonprofit organizations, as well as laboratories, for their assistance with addressing contaminated consumer products. Thank you for your time.